We've been seeing issues around overcrowding since the start of this year and before that again. But we have new figures tonight in response to a parliamentary question asked by Sinn Féin's David Cullinane about average admission times in our emergency department, which I believe are quite staggering. They are due to be published in the Irish Daily Mail tomorrow, but they show that those aged over 75 waited on average nearly 15 hours to be seen in July, August and September of this year. So to break it down, 15.3 hours on average in July, 14.8 hours in August and 14.8 hours in September. These are people over the age of 75. Our mothers, our fathers, our elderly relatives. The most vulnerable in our society, Minister. What's your reaction to that?
It's something that has been going on for many years in this country that we're determined to bring to an end. I was in Galway just last week and there were patients, again, many older patients on both sides of a corridor in a new temporary emergency department. It's something that happened before COVID. It's something that COVID has made worse and it's something that we are determined to tackle.
How long are you Minister for Health?
About just over 2 years.
OK, so over 2 years. And when you hear today those average figures, 15 hours for someone over the age of 75 to be waiting for admission in our emergency departments, what do you think?
That it's not acceptable in a modern country where we are a modern, wealthy country, and this has to end.
Who do you blame for it?
Look, it is the result of many, many years of not having enough resource in our public system. We have one of the lowest level of hospital beds, we've too few hospital doctors, and there hasn't been sufficient community care to get people out of hospital. Because while the focus is on emergency departments, actually the solutions to the emergency departments lie in keeping people well at home and then getting people into the hospital and then discharged. So what are we doing? Over the last 2 years, we've added record capacity. So by the end of the year, we'll have added about 1,000 extra hospital beds, probably about 17,000 extra staff, an entire new community care system. So we're building capacity.
So we shouldn't have those situations where elderly people are waiting over 15 hours when they go to our emergency department to be seen.
No, we can't have. We can't have.
But we do have.
We do, and it has to come to an end. Now, if it wasn't for COVID, the problem we have is that whilst we've added record capacity, record staff, record beds, record diagnostics, while we've done all of those things, we still have 400 to 500 COVID patients every day. So as quickly as we are adding capacity, unfortunately, the care needs of COVID are soaking up that capacity.
Essentially, you can't keep up. I'm just thinking of what the INMO have come out and said today. We've seen a 27% increase of patients on trolleys in the last week. Today we had a new October record, Minister, of 669 patients on trolleys, more in a single day in October than any previous year over the past decade. And with that, you know, nurses are saying that we need to have capacity now in the private sector to come in and help with this. We saw it happening during COVID times, and there needs to be this really sharp focus now on recruitment and retention of nurses and midwives. And we need to cancel, actually, elective surgery, which is a sad indictment. But would you agree that that needs to happen when you see figures like that and we're not even seeing the true effects, potentially, of a twindemic?
So certainly what I would agree with is we have to keep adding capacity and we have to modernise how we run our healthcare system. So we need more nurses, we need more doctors. Now, in fairness to the HSE, over the past 2 years, they've added more nurses, midwives, other healthcare professionals to our public system than any year on record, and they did that during a pandemic. And I think they deserve recognition for that. However, the reality is historic underinvestment in the system is taking time, and COVID is soaking up a lot of those resources. The other thing that's happening, of course, is the hospitals are seeing the highest level of people coming into the emergency departments at this time of the year that they've ever seen. And critically, we're talking about those who are older, and they are coming in record numbers, and they're coming in sicker and they're coming in more frail because of COVID.
Do you think that all non-emergency elective care should be curtailed, as the INMO is suggesting, at this point in the winter?
Not at this point, but what their call goes to is one of the real challenges we have. So we have two big challenges in healthcare: waiting lists and trolleys. And you can temporarily deal with one. You can temporarily deal with the trolley situation by cancelling elective care. But the moment you do that, people are waiting longer, the waiting lists go up, and the pressure builds on the system. So we have to try and tackle both at the same time. We have a winter plan in place that looks to hire an additional 600 or more people, and we have a very comprehensive...
And how's that going?
It's going fine. Again, we're at a record number of people recruited into the system in the last 2 years.
I'm just wondering, when you see posters up and, you know, right outside our hospitals advertising these great jobs in Australia, and we know that nursing, we know that medical staff are taking up on those positions, and we know that recruitment is a critical issue. And it's not just the INMO saying that, it's the IMO, it's doctors, it's, you know, we're hearing that right across the board as a problem. That's why I'm wondering, when you say, you know, it's going okay, how is it going okay?
It's going okay because the HSE have just had the 2 biggest years of recruitment they've ever had since the HSE was set up. So we can look at it in 2 ways. We can look at it and say more needs to be done, and it does. And we sanctioned about 11,500 extra staff this year. We know we need more nurses, we know we need more GPs, we know we need more hospital consultants. At the same time, we must focus on what's working as well. And as I said, the HSE has added more healthcare professionals to our public service in the last 2 years than ever before. What we've got to do is we've got to continue that momentum, continue adding capacity. But can I just say at the same time, there are parts of the system and there are certain hospitals where we need to run the system better. So, for example, I sent a specialist team into Limerick, sent it into Cork and Galway now. They are making improvements. They're seeing patients discharged out of hospital quicker, which frees up beds in the hospital to take people off trolleys.